So today I'm going to be demonstrating the corrective exercise continuum for someone who has lordosis, which is a really big cause of low back pain. This is a really big issue for the general population because about 60 to 80% of our population result in low back pain. So the muscles that we're trying to, the overactive muscles that we're trying to stretch out are going to be the hip flexors, the erector spinae, and the latissimus dorsi. And then the muscles that are underactive that we're trying to activate are going to be the glute max, are going to be the glute max and the hamstrings and the inner core muscles. So for the first exercise that we're going to do, we're going to be doing SMR. So it's another full move rolling exercise. So what we're going to be doing is that we're going to be basically going on a plank position on top of your quads. Roll until you find some tenderness and just hold for 30 seconds. So that's going to be our first inhibiting exercise during the corrective exercise. Have you found a tender spot yet?
Yeah.
Perfect. Alright, so I'm going to start for 30 seconds. And yeah, so it's very important that we're pretty much are just going to be actually just breaking down the knots and the muscles and trying to make them a little bit more looser. How are you feeling?
Good.
Good? You feeling a little bit tender?
Yeah.
Yeah, that's good. And if your client doesn't really feel, a whole lot of tension, you could always push on the back of his thighs to increase the tension. Do you feel a bit more tension?
Yes.
Yeah, perfect. Alright, so that's that for the first one. So the next one that we're going to do is the SMR for the latissimus dorsi. So what we're going to do, there's two ways to do this. The first way I'm going to demonstrate is with the foam roll. So how it works is pretty much you're going to be landing in a plank position, your thumb is going to be pointed up, and you're basically going to find another tender spot, so right underneath the armpit. So it's generally going to be kind of right underneath the armpit, and you're basically going to roll until you feel a tender spot and we'll hold for 30 seconds. Very important to keep your whole body in line. Have you found a tender spot?
Yep.
Perfect. So you have about 15 seconds left, and then we'll go to the other side. And you are good. Perfect. Alright, now switch sides. But instead, we're going to be doing something a little bit different. Another way to do this SMR is by using a ball. So, can you go back in the same position you were before? Perfect. Alright. And now I'm going to ask you to just pretty much just put your arm, just rest your arm like you're resting it on, just like that. Perfect. And then I'm going to take the ball and I'm going to just find tender spot and apply pressure. Have you found like a tender spot?
Yeah.
Yeah. See, it's another way to actually find the tender spot and break down the knots and the muscle. So again, we'll be holding this for 30 seconds. Also very important to keep the head supported when doing this. So, how's that? You still feel the pressure? Yeah. Excellent. Perfect. Alright, so those are two exercises for the inhibiting part of the corrective exercise continuum. Now what we're going to be doing is the lengthening part. So the first muscle that we're going to be lengthening is again the latissimus dorsi, since we already kind of broken down the broken down the muscle fibers, or the knots, and so to speak, in the muscle. So for the first one, you want to pretty much raise your hand above your head, grab the other one like that, and then you're just gonna tilt to the side until you feel a nice stretch kind of on the side. Yeah. Again, we're trying to be aiming at the back right here at the latissimus dorsi. So again, we're going to be holding for 30 seconds. So always important to keep the core nice and tight. And keep your feet pointed forward, so everything should be pretty much straight and neutral. And we're really focusing on getting this stretch. And perfect. And other side, same thing. Perfect. Try to keep the back a little bit more straighter. Perfect. And keep a nice tight core. Excellent. Do you feel a stretch in the back and along the kind of the side?
And back.
Yeah. Perfect. Alright, you have 10 seconds left, and then we'll move on to our next stretch. And perfect. Awesome. So the next one that we're going to be doing is to stretch out our hip flexors. So this is going to be called the kneeling hip flexor stretch. So you get into a staggered position. And depending on how you want to rotate it, if you want to rotate the back leg internally, that'll be getting more of the psoas. If you want to keep it in line, that's going to be focusing more on the rectus femoris. So how this one works is pretty much you're going to be standing up straight, and you're going to kind of just shift your weight forward. And you should feel stretch on the back leg. Feel stretch on the back leg?
Yeah.
Perfect. And to make this stretch more intense, one could raise the arm and laterally flex to the other side, and also have a little bit of rotation. Do you feel a little bit big of a stretch?
Yeah.
Yeah. And again, we'll hold that for 30 seconds. Alright, and we'll switch on to the other side. Same thing. And also be sure to actually contract your bent leg. So basically fire that glute. And that's another way that will make sure that it'll get more of a decent stretch. Yeah, be sure, and also make sure to have a nice tight core. So kind of bring your belly button into your bring your belly button to your spine, and perfect. Yeah, do you still feel a stretch on that one?
Yeah.
Perfect. And good. All right. And the last stretch that we're going to do is going to be for the rectus spinae, which is another overactive muscle. So this is a really nice one. It's called pretty much the child pose. So you want to be getting down into a position like this, and you just want to be walking your fingers until you feel a stretch, and we'll hold for 30 seconds. So yeah, no, just make sure, bend your legs, bring them, so your knees should be under you. So you should be resting just like this, kind of like that, and like that. So you should be pretty much on your stomach. Your knee should be right on your stomach, and then like that. Perfect. There we go. Do you feel a stretch? Yeah. Perfect, and we'll hold that for 30 seconds. Can you get down a little bit more closer down to the ground, like that? Yeah. And we are good. So that's the lengthening portion of the corrective exercise continuum for someone with low back pain and lordosis. Now we're going to activate the underactive muscles. So the first exercise that we're going to be doing is we're going to be doing a positional postural isometric for the glute max. So what I want you to do is basically kind of lay flat face down on the floor, and you're going to be flexing your knee. Perfect. So flex your knee like that, and we're going to slightly bring this out, adduct it out like that. Perfect. And then on my count, you're going to pretty much be trying to raise your leg, and I'm going to push it down. And we're going to be doing that for 4 times, one at 20% of a voluntary muscle action, one at 50, one at 75, and one at 100. So the first one, we're going to be doing it at 75, so trying to lift up. So I'll just lift your back down, trying to just lift your thigh, like that, yeah, like that. 1, 2, and 2, relax. Now we're going to do it at 50%, so bring it up. 1, 2, bring it down. And the next one we're going to do is at 75, so I'm trying to bring it up. 1, 2, and bring it down. And this one, trying to resist 100%. So yeah, 1, 2, and bring it down. So that's, and then you'll be doing that on the other side as well. So the next exercise that we're going to be doing is going to be the glute bridge. This is another exercise for the glute max, and it can also work a little bit of the intrinsic core stabilizers. So what you're going to be going is going to be in this position right here, and you're trying to be lifting your butt off the ground, but focusing on basically just using your butt and your core to get off the ground. Try not to push with your feet. Try to focus more on just using your glutes and your abs to get your butt off the floor. And we'll be doing that for 10 reps. So whenever you're ready. Okay. So yeah, back down. 1, 2, back down. 3, back down. 4, back down. 5, back down. 6, back down. 8, back down. 9, back down. And 10, back down. Perfect. And again, we could do that to about 1 to 3 sets. So the next exercise that we're going to do is we're going to be working on our hamstrings, which is another tight muscle. So this is a really simple exercise, and it could even be used with a cable machine in a gym, but since we're not in a gym, we would just basically be using a wall. So what you're going to be doing is pretty much just do a leg curl. And hold for 2 seconds and bring it down, and bring it up. Hold for 2 seconds and bring it down. Two, bring it down. Bring it up again. 1, 2, bring it down. Bring it up again. 1, 2, bring it down. Bring it up again. Bring it down. One more time. Bring it up. Bring it down. Bring it up. Bring it down. Bring it up. Bring it down. And bring it up. And bring it down. So yeah, it's very important that he keeps a tight core during the exercise, and that he really focuses on using his hamstrings. Alright, and the final one that we're going to be doing is going to be working the intrinsic core stabilizers. So it's going to be a very traditional plank. So I think we all have done a plank before, so pretty much how it is, you're just going to be resting on your forearms and you're going to be lifting up and we're going to be holding for 30 seconds, making sure that you keep a tight core by we're going to be holding for 30 seconds. So whenever you're ready, lift up. Perfect. And make sure that you're trying to focus your belly button towards your spine. Keep a nice straight back. Your back is a little bit straight. Yeah, bring it up. Try to keep a nice tight core. We don't really want any back arch. Let's bring it up a bit. Yeah. There we go. We're almost done. 5 seconds left. And you are good. Perfect. Alright. So that's the activation part of the corrective exercise continuum. Next we're going to be going into integrative. So how this one's going to work is basically we're going to take the foam roll and we're going to put it on your back and we're going to be doing a squat. To make it a little bit more dynamic, we'll be using our dumbbells, in this case soup cans. So put it on your back like that. We'll grab your dumbbells. So can you squat down for me? And curl, bring up and go into a shoulder press. So up and like that and bring it down. So yeah, and bring it down, curl, bring it back up, shoulder press, back down, and we'll be doing 10 reps. Make sure to keep your feet pointed forward. Perfect. Last one. Perfect. Alright, awesome. Alright, that's it for that one. And our last one, integrated exercise, is going to be a combination of the leg raise and the V sit-up. So you're going to be lying flat on the floor, so, and you're going to be you're going to be raising your legs, like so, and then you're going to try to touch, bring the legs back down, and repeat. So bring the legs up, and then try to reach, and back down, and back again. So legs up, and back down. So legs up first, and then go into that. Perfect. So that's 3. And back down. That's 4. So it's another way to work the core stabilizers. We're at 7. Nine. And last one. Perfect. Alright. So that was a sample, basically a sample program for someone that has lordosis and low back pain.